You've got x-rays that you can get of the prostate gland, and you've got biopsies that you can take, and that gives you some tissue that gives you better education. How do you know if it's spread or not?
So one of the things that we do is we correlate between the grade of the cancer, so what it looks like under the microscope. The cells will either be loosely organized or packed in very tightly. Clearly, if a cancer is more tightly packed, that's a more aggressive cancer, kind of crowding their neighbors. And based on that and the PSA plus the physical exam gives us some probabilities of whether or not we're going to find cancer outside of the prostate.
So you get an idea of aggressiveness by looking under the microscope at the pathology.
That's right.
Do you have scoring of prostate cancers?
Yeah, Gleason score is the most commonly used system, and we will use the system, even though it goes from 2 to 10, it technically starts at 6. So a prostate cancer of 6 is typically one we can watch or potentially treat with great outcomes, whereas with Gleason 7 or higher, we know that we need to treat those.
So the lower the number, the better the sigh of relief, and the fact that maybe you don't have cancer even would be a sigh of relief. Greater than 7 means we need to then decide more aggressively what we're going to do.